My name is Eric Marler. I'm an internal medicine physician and I work at St. Francis Primary Care downtown. When I was about 24, I was in radio and television and into rock and roll, and I was trying to find the meaning of life, and I ended up spending a year with Mother Teresa in Calcutta, and the experience changed my life. I came back a person that understood a lot more about how wonderful it is when you can help people. And over several years, I went back to school and came to decide to become a physician, and was mostly fascinated in adult health care. So I chose to become an internal medicine doctor. Well, I think that when people come see a primary care doctor, that it's all a matter of winning trust. I want them to know that I'm not a doctor that's looking at my watch, or I'm not a doctor that will look down on them, that all of us in my eyes are equal. So whether it's the farmer or whether it's the judge or if it's the teacher, that in my eyes everybody's the same, and my goal is to help them understand whatever their problems are and also to talk about problems that they may face. So I want them to understand that they have a relationship with me, which is, help them with their problem that they may have, or if they don't have any, talk about what they need to worry about as they get older. I think the most rewarding thing is that when patients see that you've helped them and that they basically trust you and they come back to see you. I'm a doctor that over the years has worked in down in the Midlands in Columbia, as well as in Spartanburg and now in Greenville, and there's nothing more rewarding than when you've taken care of patients over the years that they actually follow you wherever you go. So showing that type of loyalty is wonderful, and people, when they get to know you as a provider, realize that that's the best relationship that you can have. I think a good doctor is someone that, first of all, listens to their patients. If a patient comes to see me and that they have a problem that maybe another doctor didn't listen to, I'm there to help them. I'm not really there to protect other doctors. I'm there to protect the patient that's there to see me. I also want them to understand whatever we talked about in the conversation, that they walk away understanding that. So I think that being a good doctor means helping your patient, winning their trust, explaining to the patient what you talked about, and also answering any questions that they have. Well, I had actually asked around over the years, having worked in another organization that was very corporate-minded, and I had found out that St. Francis stood out as a place that had quality health care, but also that, surprisingly, the employees and the doctors were actually happy working there. So it was a matter of learning that it was a place where it was happy to work at, and the people in the community also looked at that way as well. I've met many patients that have gone through St. Francis, and they said that it was their hospital of choice in Greenville. That also is something that's important to me, is having a faith-based model, because I feel that you cannot, as a physician, really do your work without giving glory to God. So I really do believe that when I'm with patients, that they need to understand that when things happen to them, that it always comes back to God and helping us understand how we can deal with whatever problems we're faced with. So for me, it's very important, and I think for a lot of patients, and it makes it very different to work at a hospital that's faith-based, because so many other places don't have that, and sometimes that's the emptiness that people may feel when they go through that experience. Well, I have 3 daughters, and so I have to get used to dealing with a lot of credit card balances to pay off. I enjoy being with my family. I love traveling. I also enjoy doing something occasionally like smoking a good pork butt. And so I enjoy cooking, and I'm a person that enjoys being with family.